My name is Talat Al-Shukairat. I'm the medical director at Utah Valley Specialty Hospital. I'm specialized in lung diseases, ICU diseases, and sleep medicine as well. And I've been working at Utah Valley Specialty Hospital for the last 12 years.
My name is Stephanie Strang, and I'm a registered nurse with a background in respiratory therapy here at Utah Valley Specialty Hospital. I work with a multidisciplinary group of people who help patients who suffer from respiratory failure. Respiratory failure is when there's not enough oxygen getting from the lungs into the bloodstream, and sometimes these patients have to be supported with mechanical ventilation. That can be a very scary time for our patients. We want to be there to support them and help them through this time and see them till they get off the ventilator.
My name is Matt Harmer, and I'm a physical therapist at Utah Valley Specialty Hospital. I help our patients regain their strength, mobility, and their independence as they recover from respiratory failure. This often begins in the bed, strengthening arms and legs, progresses to sitting at the side of the bed, standing and walking down the hall while still on the ventilator. They'll have opportunity to be in the therapy gym to work on exercises and strengthening that prepare them for getting back to home and living their lives.
My name is Jenny Ofar, and I'm a case manager at Utah Valley Specialty Hospital. As case managers, we act as the link between patients and their families and the healthcare team.
My name is Ann Woodbury. I am a registered dietitian at the Utah Valley Specialty Hospital. My role at the hospital is completing nutrition assessments on patients and making sure that their nutrition is optimal to help support vent weaning. In particular, I'm making sure that they're getting enough protein to get stronger and to help strengthen their respiratory muscles.
Our hospital continues to be certified in respiratory failure rehabilitation, and it's really critical for our patients to have that certification. It ensures that we provide a higher than standard level of care to help patients come off the ventilator.
And this is important for our patients because we are able to come together from all the different disciplines and work together as a team to provide the best care for our patients.
It is important because it gives us the guidelines and the framework for our team to be able to provide excellent patient care to all of our respiratory patients.
Every patient receives the highest level of care by a team of compassionate and skilled doctors, nurses, and therapists.
Because that means they receive the best evidence-based healthcare around. When we talk about evidence-based medicine, what that means is that there are research and studies behind what we do. So we have proven outcomes. So we don't think what we do works, we know what we do is going to work.
What's amazing about our program is that we work as a team on a daily basis, where the physician meets with the nurses, respiratory therapy, physical therapy, pharmacists, and occupational therapists to address all aspects of patients' care. And we do things in a manner that ensures that patients have a great outcome. We truly strive to get better. We critique ourselves on a regular basis as well and ensure that we're providing a high standard of care based on evidence and research to give our patients the best chances to be discharged home with their beloved ones. I believe that this is really what earned us the Joint Commission's gold seal of approval for respiratory failure.
I'm passionate about what I do because I get the privilege of working with our respiratory patients, watching them progress from taking their first steps while on the ventilator to walking out of the hospital, back to home, and returning to live their lives free from the ventilator.
I am passionate about what I do because I get to see the joy on patients' faces when they achieve those things that they thought were impossible.
I'm passionate about what I do because I know that nutrition is a really important piece. So while the patient is on the ventilator, they're usually not able to eat. And so from a dietitian standpoint, I'm making sure that their nutrition is adequate through the artificial nutrition. And then eventually when they're able to come off the ventilator, they can start eating. And that's usually a really exciting process for them, that they get to eat real food again, and we're able to encourage them to order meals that they enjoy.
The things that I find myself most passionate about are the fact that these patients come to us in one of the most vulnerable times of their lives. They need us emotionally to support them. They need us to teach them and educate them so that when it is time for them to go home, they understand their whole health process and their cycle and can take care of themselves at home.
I am passionate about what I do because I get to work with great team members. We have highly qualified members of all disciplines. What's really amazing is that we have regular stories that touch your heart of patients who actually come to our facility on the ventilator, and they leave in a few weeks home with their families on a very small amount of oxygen. To be able to witness these stories and be part of it is unbelievable.